Hi there, my name is Ashley. I'm the pharmacy student here. How can I help you today?
Doctor put me on a new medication. It's different from the last chemotherapy meds that I was on. And do I really have to know the side effects?
Okay, just before we get started here, can I just get your name, please?
It's on the records. David McDonald.
All right, sorry about that. I'd just like to make sure that I'm talking to who I think I'm talking to here. And a date of birth, please?
August 18th, 1957.
All right, sorry about that. It's just
Quite annoying, you know.
I understand. It's just something that we like to do just to make sure. All right, so you said that you're getting started on a new medication?
Yes,
All right, and you had previously been on chemotherapy?
yes.
Okay, and what kind of cancer are we treating?
I had lung cancer.
Okay, I'm very sorry to hear that. Um, did you want to tell me about it, or? It's okay. We don't have to discuss it if you're not comfortable talking about it with me.
I have to. And I'm not happy with it. I just found out I went implanted never.
I'm very, very sorry to hear that here. I can get a tissue for you here. There you go.
And I'm angry. And I'm upset.
Those are all things that you're allowed to feel. Those are all very, very valid feelings. This is a very difficult disease, and I understand that. I'm here to try and make it as easy for you as possible. Do you mind if I just get a little bit of your medication history information from you before we get into the new stuff? Okay. So other than your cancer, do you have any other medical conditions?
I got a few.
Okay. Do you mind telling me about them?
I got GERD
Okay.
and hypertension.
Okay.
And my cholesterol, I've got high lipids.
High lipids? Okay.
Taking medication for those for a number of years.
Okay. Would you mind telling me which medications you were taking? Or do you have a sheet for me?
Yes. That's right. I think I got it in here. Yep, that's the one there.
Okay. The Rosuvastatin or the Crestor? And you said you've been on these for a number of years, right? Have you ever had any problems with them? No?
Not,
Okay.
not as long as I take them.
Not as long as you take them? It can be a little bit hard sometimes remembering all that sort of stuff, especially because you've got a lot on your plate now. Do you have any drug allergies?
No.
No? Okay. All right. So yes, this new medication, you were saying you don't really want to talk about it, or what is it about it that's really kind of upsetting you?
I'm just angry.
That's understandable.
But when I had the other chemo and whatnot, and I came back and it didn't work,
Mm-hmm.
why take this new one? I just might as well die.
Well, I can understand how upset that it would make you, and chemo is very, very hard on the body, and you don't want to feel bad. It makes you sick, and then to find out that it doesn't work. Did you have lots of side effects from the chemo?
Nausea and really tired.
Nausea and really tired? All right. This new one, luckily, generally it's not as hard on the body as chemo, like lots of that nausea and stuff like that isn't really associated with it. There are some side effects that I can talk to you about if you're willing to talk to me about them. Okay.
By all means.
All right. So we have these information sheets here. I can go through it with you if you like. All right. So Tarbesa is the brand name. Erlotinib, it's just the generic name. It's kind of trickier to say. What this medication does is it works a little bit different than chemo, whereas chemo targets your entire body. This targets just specific cells to your cancer, so that's why it doesn't have as many side effects. One of the main things that you want to watch out for with this medication is it might cause a bit of a rash.
Okay.
It usually starts a couple weeks after your therapy begins. And what will happen is it looks kind of like acne. Have you ever had acne? So it will look kind of like that, but it will be not just limited to the face like acne typically is. And there's a number of things we can do for it if it starts to bother you. In terms of making sure that it doesn't happen, just using like mild detergents and soaps. Do you have any family here with you today?
Yeah, my wife.
Okay,
My
and
kids are at home.
okay, we can give this information to her as well.
Okay.
But yeah, just lukewarm water in the shower is nothing too hot. Just try and avoid anything that will really sort of irritate the skin. Like, don't sit out in the sun for a long time. You make sure you're using lots of lotions to keep the skin moisturized and stuff like that. Another common one is diarrhea, and that is a little bit unfortunate. Generally, not too severe. There are a number of things we can do for you should it occur. Even something like Imodium, we can do that for you if you.
Oh, if I get the diarrhea.
Mm-hmm.
Okay.
We generally don't recommend taking it before, just so
Yeah.
you don't have anything that you don't need. I can definitely. Sorry. Did you have any other questions about this new medication?
They say that sometimes, like you'd mentioned diarrhea.
Mm-hmm.
They say that dairy products, you shouldn't take dairy products if you've got diarrhea. Should I stop taking dairy, or? I mean, you hear it on the radio and television.
Have you ever had a problem like with diarrhea when you've eaten dairy products or anything like that?
No, not at all.
Okay, I personally have not heard anything about that, but it's definitely something I can look into for you and get back to you.
Mm-hmm.
Okay.
And the diarrhea, when am I expecting it to start?
It can start. Usually, I believe it's within the first couple weeks of therapy.
Oh, okay.
Okay.
Like when I start taking this new
Mm-hmm.
drug.
Yes. Do they have a start date for you?
Well, he said to talk to you, and they'd probably go, and if I decide that I'm going to take it, just go and get it filled right away, and sooner I take it, sooner I stop.
Mm-hmm. And that's kind of what we want to look into. Like, I'm just going to double check with the rest of your medications to make sure that there's not a problem. That's always something we should do when we start someone on something.
Okay.
But yeah.
Go ahead and start it, and if something happens, that you find something.
I'm going to look first before we start you on it, just so we don't have to start you on another one and then stop you and switch you to another.
Okay. So just wait
Yeah,
for a couple days or whatever.
If you're willing to give me that time.
Yeah. Yeah.
Okay, for sure. So other than that, did you have any questions for me?
I'm scared.
I understand that. That's completely fair, especially since you're having a tough
I
go of it.
wasn't angry at you when you first came in. I was angry at the world.
No, and I understand that, and it's really, I take nothing personal by it. I understand your situation and how hard it can be, and I just want to be here for you to make it as easy for you as possible.
I do appreciate that very much.
Thank you very much. So I will look into this and your other medications that you're on. With the GERD, have you been having any sort of like symptoms of like acid reflux or anything recently?
Well, the other day I stopped taking it for a couple of days, and I suffered.
Oh, okay.
So my wife, she says, well, if you do what you're told and take your medication, you won't have a problem.
All right. Well, that's good to know she's looking out for you. So yeah, I will take a look at this and the medications that you're on, and I will get back to you, and then we'll go on from there.
Okay, I do appreciate that.
For sure. All right. Thanks very much, David.
Thank you so much.